reason, even while sitting down? You're not alone. Lightheadedness and dizziness are some of the most common symptoms reported in both clinics and ERs. But what's really going on in your body? Today, we'll uncover the most common causes of dizziness, how to tell when it's serious, and simple steps you can take to feel steady again. 1. What is dizziness? Let's start with the basics. Dizziness is a general term that describes a range of sensations, from feeling faint or woozy to feeling like the room is spinning. It can affect your balance, vision, and concentration, and even lead to falls or anxiety. Some people describe it as lightheadedness or floating unsteadiness when walking, feeling like you might faint, vertigo, a spinning or tilting sensation. It's not a condition itself, it's a symptom, and your body is trying to tell you something. 2. Dehydration. One of the most common causes of lightheadedness? Dehydration. When you don't drink enough fluids, especially in hot weather after exercise or when you're sick, your blood volume drops. Less blood reaches your brain, and you start to feel faint or dizzy. Warning signs of dehydration include dry mouth or cracked lips, headache, fatigue, dark yellow urine, fast heartbeat. What to do? Drink small amounts of water throughout the day. Add a pinch of sea salt and lemon to support electrolyte balance, especially if you've been sweating or vomiting. You don't need fancy sports drinks, just real hydration with minerals your body recognizes. 3. Low blood pressure, hypotension. If your blood pressure is too low, especially after standing up, it can make you feel lightheaded or dizzy. This is called orthostatic hypotension, and it's more common in older adults, those on blood pressure medications, or people with adrenal fatigue. Signs your blood pressure may be too low: dizziness when rising from bed or a chair, blurred vision, weakness or shakiness, cold hands and feet, fainting spells. Natural tips to support healthy blood pressure: stay well hydrated, add sea salt to your food if approved by your doctor. Avoid standing up too quickly, wear compression socks if recommended. Support adrenal function with B vitamins, magnesium, and rest. If you suspect low blood pressure is a regular problem, get it checked. It could be a side effect of meds, hormone changes, or dehydration. 4. Inner ear imbalances. Your inner ear plays a huge role in your sense of balance. Inside your ear are tiny canals filled with fluid and sensors that send signals to your brain about movement. If something disrupts that system, like an infection, inflammation, or buildup, you may experience vertigo, which feels like the world is spinning. Symptoms of inner ear dizziness: sudden spinning sensation, nausea, loss of balance, trouble focusing your eyes, feeling pulled to one side. Common causes include viral infections, benign paroxysmal positional vertigo, BPPV, when crystals in your inner ear get dislodged, Meniere's disease, involving fluid buildup in the ear. Natural support: try the Epley maneuver, a series of head movements. For BPPV, use ginger or peppermint for nausea. Avoid caffeine and alcohol, which can worsen inner ear inflammation. Stay upright and avoid sudden head movements during flare-ups. 5. When to worry: serious causes of dizziness. Most of the time, dizziness is mild and manageable, but there are times when it's a red flag. Seek medical help right away if dizziness comes with chest pain, sudden weakness or numbness, slurred speech, difficulty walking or seeing, sudden severe headache. These can be signs of a stroke, heart issue, or neurological condition. Don't wait. Listen to your body. 6. Gentle remedies to restore balance. If your dizziness isn't urgent, small lifestyle changes can help restore balance naturally. Drink water first thing in the morning. Add electrolytes like magnesium, potassium, and sea salt. Get up slowly, especially from lying down. Practice grounding exercises, like walking barefoot or slow breathing. Eat smaller, more frequent meals to avoid blood sugar dips. Support inner ear health with anti-inflammatory foods and gentle movement. Your body thrives on balance, and dizziness is often a gentle nudge toward rebalancing your system. 7. How Heart of the Rockies Home Health Care can help. At Heart of the Rockies Home Health Care, we believe in listening to your body's signals and responding with natural, empowering care. Whether you're dealing with chronic dizziness, recovering from illness, or simply looking for holistic ways to support balance and circulation, we're here for you. Explore natural wellness resources, nutrition tips, and home care support at ertsofthetrockies.com. Feeling dizzy isn't always something to fear, but it's always something to notice. If this video helped you, comment below and share your experience. Don't forget to like, subscribe, and stay connected for more natural health insights, rooted in care, balance, and understanding. Stay grounded, stay well. When you hear the term home health care, what comes to mind? A nurse at the bedside of someone critically ill? Expensive care that only wealthy people can afford? The truth is, home health care is far more accessible, flexible, and empowering than most people realize. Today, we're going to break down exactly what home health care is, how it differs from other types of care, and debunk some of the most common myths that might be keeping you, or someone you love, from getting the support they need. 1. What is home health care? Let's start with the basics. Home health care refers to medical care provided in the comfort of your own home by licensed professionals, typically nurses, physical therapists, or certified aides. It's designed for people who may be recovering from illness or surgery, living with chronic conditions, or needing medical support to remain independent at home. This isn't just a luxury service. It's a medically prescribed and regulated form of care that can include wound care injections or IV therapy, monitoring vitals or chronic conditions, medication management, physical, occupational, or speech therapy, patient and caregiver education. The goal? To help you recover faster, stay healthier, and live more comfortably. Right where you belong, at home. 2. Home health care versus hospice or non-medical home care. Here's where people often get confused. So let's clear it up. Home health care is medical in nature. It's prescribed by a doctor, covered by Medicare and most private insurance plans, and focused on recovery or stabilization. It's short-term, goal-oriented care, not end-of-life care. Hospice care, on the other hand, is for individuals facing terminal illness, often in the last 6 months of life. Hospice is focused on comfort, not cure. Non-medical home care provides help with daily activities like bathing, dressing, meal prep, or companionship. It's not usually covered by insurance and is not provided by licensed medical professionals. Home health care sits in the middle. It's skilled care to support healing, independence, and dignity. Myth 1. Home health care is only for the very sick. This is one of the most common misconceptions. Home health care isn't just for people who are critically ill or bedridden. In fact, many patients receive short-term care after a hospital stay, a fall or injury, starting a new medication, a joint replacement or surgery, a change in their condition. Some may need physical therapy to regain strength. Others may need a nurse to help manage a new diagnosis like diabetes or COPD. Home health care is for anyone who wants to heal, stay safe, or manage a health condition without going back to the hospital. Myth 2. It's too expensive. Here's the good news. Home health care is typically covered by Medicare, Medicaid, and most private insurance plans. If your doctor recommends it and you meet basic criteria, like being homebound or needing skilled care, insurance will usually cover the costs. In fact, home health care is often more affordable than extended hospital stays or long-term facility care. Plus, you're not just saving money, you're gaining the comfort, privacy, and personalized attention that only home can provide. 3. Who benefits most from home health care? Home health care can be life-changing for older adults recovering from surgery, individuals managing chronic illnesses like diabetes, heart disease, or stroke, those transitioning from hospital to home after an injury, people who want to avoid institutional care but still need medical support. It also brings peace of mind to family members, knowing their loved one is being cared for by skilled professionals, without the stress of travel or unfamiliar facilities. At Heart of the Rockies Home Health Care, we meet you where you are, literally, and walk with you toward better health. 4. The natural wellness perspective. Home health care doesn't just address medical needs, it also supports your whole wellness. We believe healing happens faster when you're surrounded by loved ones, following a personalized plan. able to move, rest, and eat on your own schedule. And when natural wellness is part of that plan, like nutritious meals, stress reduction, movement, and herbal support, outcomes improve even more. At Heart of the Rockies Home Health Care, we integrate natural and practical tools that help you heal holistically. Home health care isn't just for the sick, the wealthy, or the elderly. It's for anyone who wants healing with dignity, support with compassion, and the comfort of recovering in the place that feels most like you. Home. What questions do you have about home health care? Drop them in the comments. We'd love to help. Like this video if you found it helpful, and subscribe for more insight from Heart of the Rockies Home Health Care, where healing begins at home. Recovering from surgery? Managing a chronic condition? Or maybe you're a caregiver feeling overwhelmed? You've probably heard of home health care, but is it right for you or your loved one? Today, we'll walk you through what home health care is, who qualifies, and how to know if it's the right fit. Let's simplify it so you can make a decision with confidence. 1. What is home health care? First, a quick refresher. Home health care is licensed medical care delivered in the comfort of your own home. It's typically prescribed by a doctor and provided by registered nurses, physical therapists, or aides. It includes wound care injections or IV therapy, monitoring chronic conditions, medication management, physical or occupational therapy, patient and caregiver education. The goal? To recover faster, manage ongoing conditions, and stay safe at home, all while avoiding hospital readmissions. 2. Who qualifies for home health care? To qualify, most insurance companies, including Medicare, require these basic criteria. You must be under the care of a physician who orders home health services. You must need skilled care, like nursing, therapy, or medical monitoring. You must be homebound, meaning it's difficult to leave your home without help, not necessarily bedbound. If you meet these conditions, home health care is likely covered and accessible, often with little or no cost to you. 3. Common scenarios where home health care helps. So, who actually uses home health care? Here are some real-life situations where it can make a major difference after surgery or a hospital stay. If you're recovering from a knee replacement, heart surgery, or hospital stay, skilled nursing and therapy at home helps speed recovery and reduce complications. Managing chronic conditions. Living with COPD, heart failure, diabetes, or arthritis, home health nurses help monitor symptoms, prevent flare-ups, and adjust care as needed. Medication management. If you or a loved one takes multiple medications, home nurses can prevent errors, explain side effects, and ensure compliance, especially important for older adults. Frequent falls or balance issues. If mobility is a concern, in-home therapy and safety assessments can prevent injuries and increase independence. Family caregiver support. If you're caring for a parent or spouse, home health offers education, relief, and a reliable care partner. 4. Benefits of choosing care at home. Why do so many people prefer home health care over facility care? Because it offers personalized attention, one-on-one care tailored to you, greater comfort, recover in your own space with your routine lower risk of infection, compared to hospitals or rehab centers, emotional support, being near loved ones can lift your mood and motivation, cost savings, often less expensive than long-term hospital or nursing home care. It's about healing with dignity and getting the care you need without leaving home. 5. What home health care is not? Let's clear up a few common misconceptions. Home health care is not hospice. It's focused on healing and recovery, not end-of-life care. It's not 24-hour care. Nurses and therapists visit on a schedule, typically a few hours per week. It's not for non-medical tasks like cleaning or errands that would fall under personal care or companion services. If you need both medical and daily living support, we can help guide you to blended solutions. 6. What to expect from Heart of the Rockies Home Health Care. At Heart of the Rockies Home Health Care, we believe in compassionate, holistic care that meets you where you are. From your first visit, our team works closely with your physician to create a care plan that fits your health goals, schedule, and lifestyle. We don't just treat conditions, we empower you to take charge of your recovery with education, emotional support, consistent communication, respect for your preferences, and routine. And 7. Still not sure? Here's what to do. If you're unsure whether home health care is right for you or your loved one, you're not alone. That's why we offer a free consultation to help you explore your options. Visit heartsoft@rockies.com to speak with a care coordinator. Home health care isn't just for the seriously ill, it's for anyone who wants skilled support, greater independence, and healing in the place that feels most like home. If you're wondering if home health care is right for your situation, visit our website for a free consultation. No obligation. Like and share this video if it helped, and subscribe to Heart of the Rockies Home Health Care for more trusted insights on healing at home.